Hi, I'm Dr. Rob Danoff for ARIA Health Medical Mythbusters. You ready? Okay, this was the myth or the fact. Having varicose veins is not a medical concern, but it is an ugly concern. Is that a myth or is that a fact? Well, joining us today is Dr. Aaron Shiloh, who is the Section Chief of Interventional Radiology at ARIA Health. Dr. Shiloh, you work with a lot of people with varicose veins. Please, is this a myth that it's not a medical concern, it's only an ugly concern, or is there something more to it?
Well, in fact, Rob, it is a myth that it's only a cosmetic problem.
All right, so let's start off. So we need to be concerned about varicose veins, that it could be a medical problem. What are varicose veins?
Varicose veins are abnormal blood vessels that develop in the legs, and it's due to a problem called reflux. And reflux is that blood is coursing in the wrong direction. So blood is supposed to go down the foot to the toe through an artery and return back up through your veins. Those veins have valves, and they're supposed to prevent the blood from going back down in the wrong direction. As we age and due to multiple other problems, the valves start to not function right, and it causes reflux. Reflux leads to formation of varicose veins.
So besides those ugly big things we have in our legs, what are some of the medical concerns or causes that we should be, worried about?
Right. Well, varicose veins primarily are caused by a genetic predisposition to it. So if your mom had it, father had it, there's a chance you're going to be getting it. The other things that happen are having children, so of course women who have had multiple kids, and then certain people who have jobs where they stand on their feet all day long, nurses, teachers, hairstylists, etc. People who are on their feet all day can be more predisposed to developing varicose veins. Clearly people don't like how they look, but they can develop into more significant medical problems. As the varicose vein disease progresses, and it's a progressive disease, you can develop more significant issues like swelling in the leg or edema. You can have unrelenting pain, heaviness, fatigue, itching, burning, or restless legs. And then the most dreaded thing is over time, if you really develop swelling in the leg, you can develop ulcers called venous stasis ulcers. So it is a progressive disease. It is a true medical disease.
And especially people with like diabetes or circulatory disorders, this is a concern.
Absolutely.
So what can be done about them? What are the treatment options?
Well, if you have documented reflux, which we do with this ultrasound machine, once you have documented reflux, then there are very minimally invasive treatments that we do in our office, in a room just like this, with local anesthesia, that have replaced the traditional option, which was surgery, something called a vein stripping, where the vein was literally removed or ripped out completely. In this treatment, we basically access the vein under ultrasound with lidocaine. We put a wire in there, and you can either use laser or radiofrequency ablation, which then heats the vein and basically destroys it so that the blood will then go in the appropriate direction.
So when you do this, what do you hold this with a little goop and you put it on the leg, and what are you looking for?
Right. Well, when we, as either the physician or an ultrasound tech, and we have excellent technologists, you do an ultrasound for this disease, we are looking to see if the blood is going in the right direction. As I said, blood is a one-way street, and it should go down the foot in the artery and back up in the vein. We are able to see with the ultrasound if blood is going in the wrong direction. So the study would be done typically with a person standing, and they want to make sure that it's only going up towards the heart, and we can see that with the machine. If it's going in the wrong direction, you have venous reflux disease, and then we can treat you with our minimally invasive treatments.
So guess what? There's another option. It's not surgery, and it doesn't hurt much, and you'll do good. And not many places do this routinely, but you do.
Right.
So for more information or to contact Dr. Aaron Shiloh, please go to yourariahealth.org and we'll help you out.